This episode of the Nurse Practitioner Podcast is sponsored by Dakins. When you're treating persistent, hard-to-heal, or complex wounds, you need a solution you can trust, like Dakins Wound Cleanser. Just how powerful is it? Dakins Wound Cleanser has been proven to kill even highly resistant bacteria, like MRSA and VRE, within only 30 seconds. It's non-cytotoxic, shelf-stable for 2 years, and more cost-effective than other wound cleanser brands. When you need a solution you can count on, ask for Dakins. In this episode of the Nurse Practitioner Podcast, Dr. Efrat LaMandre and Gina LaMandre discuss how to create an LGBTQ affirming practice. Dr. Efrat LaMandre is a family nurse practitioner who owns and operates her own family medical practice, EG Healthcare. Dr. E and her staff pride themselves in serving the entire community, including the underserved population, and are LGBTQ inclusive. Her practice provides pediatric, adult, and geriatric medical care. Additionally, her practice offers house calls for senior patients who need primary care in the safety and comfort of their own homes. Her practice consistently meets and exceeds industry standards and has achieved the honor of PCMH status, indicating excellence in patient care. Dr. E also has an integrative medicine practice called The New Method, where she empowers patients to take control of their health destiny. Additionally, she owns a medical scribe company called Hawk Scribes that allows providers to focus on their patients instead of their charts. Dr. E is co-chair of Staten Island University Hospital Foundation Board of Trustees and also serves as the president of the Nurse Practitioner Association State Board. In addition, she is clinical faculty at Wagner College and the primary care provider for the City University, New York, College of Staten Island Athletic Department. Dr. E is also a public speaker and serves as a consultant to other nurse practitioners who are opening up their own practice. Gina LaMandre is a professor and coordinator of didactic education at Monmouth University for the Physician Assistant Program. In addition to teaching physician assistant courses, she is also a frequent guest lecturer for the Nurse Practitioner Program at Wagner College. Prior to her position at Monmouth, she was the director of clinical education for one of the largest PA programs in the country at Massachusetts College of Pharmacy and Health Sciences. Clinically, she worked at Robert Wood Johnson ER for 10 years and in a community health clinic for the underserved population for 6 years.
Thank you so much for that introduction. So I am E and I own EG Healthcare. And the reason it's called EG Healthcare is because it's named after me, E, and my wife, G, Gina. And today we're going to talk to you about how to create an LGBTQ affirming practice. But before I start talking, I just want G to say hello.
Yes, thank you for that introduction. And I did want to say hello.
Okay, so it is Gina's first podcast, so she's a little bit nervous. So everyone be forgiving and kind. And, if you haven't tried it, you should try it. It's pretty nerve-wracking. So first, this is an episode that's particular for June. It's Pride Month. And I want to applaud every single listener who's listening to this. Because the fact that you clicked on this means that you're interested in finding out how to create an LGBTQ plus affirming practice. And that's the first step. The fact that you're even here, the fact that you're even asking the questions already means you're in the right direction. So I want to applaud you for that. And I also want to remind you that it is okay to mess up. So we're going to give you some tips today. But if you mess up and you're with a patient and the encounter didn't go exactly as you had imagined or you stumbled, that's okay. We all do that. Just apologize and say, hey, I didn't mean to disrespect you, and start over. Because speaking as a member of the community, it is so much better to be in an environment where someone's trying, even if they mess up a little bit, as opposed to an environment where no one cares. So I applaud you for being here. And with that, we're going to start. So the very first thing I want to talk about is defining a few definitions. What is LGBTQ plus? Like, it's an acronym. What does it stand for? What the heck is the plus about? It's a little confusing. So I'm going to break it down. Now, I'm going to say this. There's a lot of definitions. I'm not going to go through all of them. And as much as I try, I might even offend someone, even though I am from the LGBT community. So I'm sorry if I offend anyone. My goal here is to educate, but also to provide shortcuts. And sometimes in shortcuts, things get missed. So I apologize in advance. I don't mean to disrespect anyone. So LGBTQ stands for lesbian, gay, bisexual, transgender, and Q is either for queer or questioning. But what we discovered, this was an acronym that's used from the 90s, we discovered is that it wasn't inclusive enough. And so a lot of things were added after the Q. Different people have different acronyms. It can go as long as QQI, AAP, 2S. And I'm not going to go into every single type of acronym, but the plus indicates that you're aware that there's more than just LGBTQ. And so in any literature you provide, when you're speaking, you just want to put that plus in there. It means that you're aware that there's more and that you are ready to be inclusive. Now, there are some terms that you want to know. First is sex versus gender. Sex is assigned at birth based on external anatomy, what the doctor, the NP, the PA sees. So they look at the external anatomy, a certain assumption is made, and you would say this person was assigned a female at birth. That's sex. So typically it's male, female, or intersex. Gender identity is what the person's internal sense of gender is. Okay, so sex is based on anatomy and gender is internal sense. That brings us to two more terms. Cisgender means that your sex assigned at birth and your gender that you feel internally, they match. Cisgender. Transgender means that the sex that you were assigned at birth doesn't match the gender that you feel inside. And that's what a transgender means. And so those terms will kind of get you halfway there. Now, all of that has nothing to do with sexual orientation. Sexual orientation is who you're attracted to emotionally, romantically. And those are terms such as gay, lesbian, bisexual, pansexual, heterosexual, asexual. And there's more. But there needs to be an understanding that we have one conversation, which is about sex and gender, and that's who the person is, versus who they are romantically or sexually involved in, and that's their sexual orientation. If you get these terms down and these concepts down, you're already there. And for a lot of people, that's confusing, so I want to start there. And another term to know is ally, because many of you listening are allies, and that means that you're probably cisgender, meaning your sex and your gender matches. Heterosexual, meaning you're not part of the LGBTQ plus acronym, but you really are vested, supportive, inclusive, and so you're an ally. And if you're listening to this and you're cisgender and straight, then you're an ally. Congratulations to you. That's pretty awesome. And thanks for being here. And we need the allies. And so thank you for that. So far, so good?
So far, so good. So, Efrat, why is it important to make a practice LGBTQ plus affirming?
Okay, excellent question, Gina. So why is it important to make a practice LGBTQ? You know, some people might say, you know, what's the difference? A practice is a practice. Why do we need one that's specifically LGBTQ plus affirming? So let's take a moment to discuss why it's important before we even jump into how we do it. So first and foremost, the LGBTQ plus community is a minority. And as a minority, it's subject to a lot of discrimination. I'm going to give you some statistics. Studies show that experiences of interpersonal discrimination are so common for LGBTQ adults, including slurs. So 57% of the people who are interviewed experienced slurs, microaggressions, sexual harassment, violence. 51% are experiencing violence just because they're LGBTQ plus. Harassment regarding bathroom use. More than 1 in 6 LGBTQ adults report avoiding healthcare due to anticipated discrimination. And that's including transgender adults. And 60% of LGBTQ adults report discrimination in healthcare encounters. So it is a really big deal, not only discrimination in general, but this fear of discrimination in the healthcare system means that there's less access to timely preventative healthcare service. And any of you who are in primary care, you already know that access to primary care, people not getting to primary care, is already a problem in populations that are not discriminated against, let alone a population that is. And we know that if we don't get timely preventative care, you're going to have negative health sequelae. And then if they are coming in, they've already braved and they said, you know what, I'm going to come in. Oftentimes the LGBTQ community is faced with systemic discrimination in the healthcare system, or outright homophobia and transphobia when they're seeking services. And sometimes, even if they're able to pass that, then they get into the exam room with providers who are not knowledgeable and not competent in LGBTQ health issues. So all of this will create poorer health outcomes, and Gina's going to go into that in a moment, poorer health outcomes for the community. So you attribute it to stigma and discrimination, but also the likelihood that they're less likely to go and seek care. Now, as always, anyone who's in primary care, you know that in addition to health care, there's the whole world of social determinants of health, which also influences your medical outcomes. So the LGBTQ community, when it comes to social determinants of health, because of their discrimination, is also not faring as well. So 14% are homeless. They're 2 times more likely to be unemployed. 70% are mistreated in shelters. At all ages, they're going to be harassed in school. They're going to be harassed by the police, more likely to be harassed by the police. So overall, this is a population that really needs our services and our screenings more than ever. Now, Gina is going to talk about some of the unique medical issues that the LGBTQ community is faced with.
Thank you. Before I talk about the health issues for the community, we need to remember in primary care that the usual primary care issues that are relevant to the age group need to be addressed. And what I'm talking about are screenings, colonoscopies, mammographies, cholesterol screenings. Now let's talk about some of the issues for the community. Because of the lack of access to care for the reasons Efrat mentioned, minority stress, discriminations, we're going to see in the community higher STD rates. Patients aren't going to be want to come in and be tested. They're not going to come in and get treated. So in the community, you're going to see higher rates. So it's a loop that they're going to be in. We're going to see higher mental health issues for all the reasons that Efrat already addressed: discrimination, life in the closet, minority stress. So we're going to see depression and anxiety. Once again, they're not going to come in to be screened, to be treated. So they're going to stay with these conditions. Also because, now I do want to say that this health issues is for all minorities as well. They're also going to engage in behaviors that lend itself to more health issues, such as smoking is increased in this community. Obesity, especially in the lesbian community, drug and alcohol abuse are at higher rates in the LGBTQ plus community.
Sorry, I was going to move after you.
Okay, thank you. Now, let me get specific. So for men who have sex with men, you're going to see higher rates of HIV transmission. Why? Well, the virus is more prevalent in that community, so they're going to be higher exposed. Men who have sex with men who engage in anal sex, the skin around the anus is thinner, so it's more apt to have micro tears, which is going to increase transmission of the HIV virus. In the lesbian community, you're gonna see patients who have been not taking contraception, haven't been pregnant. So over time, their constant exposure to endogenous hormones are going to give them a higher rate of ovarian and breast cancer, coupled with the fact that they're more likely to be smokers, obese, and drink alcohol, which also increases the risk for these cancers. In the transgender community, they're at risk for everything that we've already discussed, but if they're on hormones, even if you're not a specialist, you need to remember some of the risk factors of these hormones. For example, if someone is on testosterone, think about a high hemoglobin and hematocrit. You have a higher risk of clots, hypertension, and sleep apnea. If someone is on estrogen therapy, they're going to have a higher risk of clots. They're higher risk for heart attack and strokes.
Okay, so now that we told you the reason why it's important to have this care and the medical issues facing the community, and remember that they're not just LGBTQ, as Gina said. You also have to consider everything else you would consider in primary care, right? So if they're 50, they have their colonoscopy. So everything you consider in primary care, and then add to that everything that's specific to the community. So now that we know that, let's talk about the steps that we could take to make your office more LGBTQ affirming. And I'm going to talk about kind of the ideal scenario, and hopefully you can implement what you can. So it starts before the patient even walks into the office. It starts with visibility on your website. You want to put somewhere in there LGBTQ affirming, LGBTQ friendly. If you look at EG Healthcare, we have it on ZocDoc, we have it on the website. It is there because the community will look for that, because then they know it doesn't have to be huge, it doesn't have to be your entire website. Somewhere in there, that little sentence, LGBTQ affirming, will let the community know that it's a safe space for them. So that happens before they even walk in. Once they walk in, again, something small. We have in our entranceway a small rainbow flag that is part of other decorations. And it's just the people who are looking for it see it, and they know that they're in the right place. So consider putting that in there, a small sticker on the window or in the reception area. Bathroom signage. Bathroom signage is a big deal. If you're walking in somewhere that has kind of old school boys, girls, men and women, kind of written out, that's going to be a little off-putting. Consider, signs that just have images, and you can get them anywhere, and they're not expensive. So if it's a single bathroom, you can have kind of all gender signage. Even though it's kind of obvious it's a single bathroom, but just having that image there lets people know that you thought of it, and again, that they're in a safe place. And if it's a bathroom for multi-use, then you want to create signage that allows for gender identity and gender expression and inclusivity in the bathrooms. Then we move on. So we walked in. Before we walked in, we went to the bathroom. Now we have to fill out a form. The intake forms are a really big deal. And again, you just have to create a small space. It doesn't, you don't have to create an intake form that is rainbow colored, but small areas like preferred name, gender identity, preferred pronouns. For the general population, they won't know what it is and they'll skip it. But for the population that's looking for it, it makes such a difference. They already are exhaling while they're in your waiting room, knowing that they're in the right place. Now, I'm going to be upfront with you. Every once in a while, I'll have someone who's irritated by it. I'm going to tell you what, that's okay. Let it go. So it's all right, because the majority of people will either not pay attention to it, and the people who need it are going to be happy that they have it. Were you about to say something?
No.
Okay. So now we're moving on to the staff. Everyone, it doesn't just start with the provider. Everyone has to be trained. There's some basic training that's free, that's online, that the staff can all go through for LGBT affirming practices. But they have to be comfortable with the language. They have to be comfortable with pronouns. They have to be comfortable with the concept of preferred names. The EMR should have a space for it. Make sure that you choose an EMR that has that. And then you want to choose words like partner, significant other, spouse, instead of husband and wife, parent and guardian, instead of mother and father, siblings, instead of brother and sister. So it creates an inclusive environment, and then you are less likely to misgender someone, right? To choose to accidentally call the wrong gender. And you can also say things like, how may I help you? Instead of how may I help you, sir, or how may I help you, ma'am. I can tell you this happens to me a lot, especially on the phone. You just don't need to add the sir or the ma'am, and you can still be as polite as you want to. You could just say, how may I help you? So these are small little sentences and small little moments that, if not done correctly, can really set the stage for the patient before they even walk into the room. They're already not comfortable. But if done correctly, then they know they're in a safe place. And again, if you mess up, just apologize. It's all good. We all mess up. Just apologize and move on. So now the patient walked into the exam room, and now it's the exam and the provider. So the provider really needs to be comfortable here. They need to be trained here. And if they're not comfortable, if any of you here are not comfortable, that's okay. Like I said, just apologize. But the more you do it, the more comfortable you'll be. So we always talk about getting a sexual history, but it's really important to first ask if it's okay to take a sexual history. Okay, so you don't just walk in there with your stethoscope and your white coat and just be like, okay, let's ask you all of these like really intimate questions. Ask, is it okay if I take a sexual history? Just asking that already changed the entire environment in the room. So ask that question. And then when you ask the question, I'm going to go through some questions, and hopefully you guys could attach the source to the podcast somehow on your website so people can have it. So I'm just going to pull this up. Just give me a brief moment because I want to give you some options. So The interview is 8 P's. I didn't invent this. I'm going to give you the source. So the first P is preference. Do you have a preferred language that you use to refer to your body? And you can say, I'm going to use medical terms. But if you have a term that you want to use, for example, you might say breasts, but somebody might prefer you to say the word chest because breast for them is triggering. So you're going to ask them, do you have a preferred language that you use to refer to your body parts? Go ahead and ask. And actually, before I even start these pieces, I just want to say this. The studies have shown, of course, once you ask for permission, if you can take the sexual history, that if you ask, the patients are waiting to tell you. If you don't ask, if you come in the room assuming that, they'll just let me know, what's going on with them, if they're gay or straight or whatever, they're not going to. Most likely, they're not going to volunteer that information. But if you ask and ask correctly, they will be more than happy to give you the information because they want to be treated. They want medical treatment. So go ahead and ask and don't assume that they're going to give you the information. So back to the piece. So preferences. Do you have a preferred language, preferred words that you use? Are you currently sexually active? We're asking them about the preferences. And what kind of sex do you engage in? So don't assume that everything is the way you know it to be in your world. Partners. Are you sexually active with one partner or more than one? Are you dating anyone or sexually active? Do you have any outside partners? And then you want to ask, how would your partners identify themselves in terms of gender? Because we used to be taught, you walk in and you say, how many partners have you had in the past 12 months? Are you sexually active with men, women, or both? But that is really so limiting. So the way you want to ask it is, how would your partners identify themselves? And then they can tell you using the language that they're comfortable with, and just asking them that way already shows that they're in the right place. Practices. You want to ask, you have to get comfortable asking, do you use toys? Do you share these toys with others? Do you have any other type of sex that I haven't asked about? If you're not sure if you covered it, just ask that question. Do you have any other type of sex that I haven't asked about? And then you want to talk about protection. Are there kinds of protection that you use? Are you using a condom? Are you using any other type of contraception? And then ask why or why not, and find out what the reason is. Because sometimes you'll be surprised. Sometimes they'll tell you, well, I would love to, but my partner won't let me. And that was a red flag. So ask why or why not. Past history of STDs. And if so, when, how was it treated, etc. And then we're going to move on to pregnancy. This is a big one, especially for anyone who's presenting or expressing their gender as male. You might make the assumption, well, this person doesn't want to get pregnant, right? They're a transgender male, they're presenting as male. Don't make that assumption. If they have the body parts, they may be considering getting pregnant or wanting to start a family. So ask the question. It's okay. Have you considered fertility preservation? Have you thought about having your own biological children, carrying a pregnancy? Ask it. And then, when you're having sex, is there a possibility of you being pregnant? Because then we might need to discuss contraception again. Here's one that might be a little uncomfortable for people, the P for pleasure. And you were going to ask about pleasure for a few reasons. One, it's good to know, right? So are you able to get physically aroused? Can you achieve an orgasm? That's good to know. But it's also a way to determine if someone's maybe being pressured or not in a good relationship. Are you having sex for pleasure, or are there other reasons? Survival, transactional. So you want to ask that question, because if you say to someone, hey, are you enjoying sex? And they're like, no, I hate it. I'm forced to do it. It's a way to really get to that question, to that answer, in a way that you may not have thought of. And that brings us to the last one, which is P for partner abuse. Has anyone ever forced you or compelled you to do anything sexual that you did not want to? Is there any violence in any of your relationships? And again, you'll find ways to say it in your language, but you want to make sure you cover all that. That is a true sexual history. And if you've noticed, I've never really used sex or gender in any of these questions. So make sure to allow for that space. So did I cover everything?
Yes, we did.
Okay, good. I know it's a lot, You'll get used to it.
But I think it's also important, like, as a provider, you have to show that you're comfortable asking these questions.
Yes.
Because the patient will pick up very quickly that you're not comfortable.
Yes, absolutely. And the more you practice, like anything else you've learned so far in medicine, the better you'll get at it. Just put yourself out there. So now you've asked the questions, and now you're able to make the determination of what's next, right? Just like if you ask someone, if you know someone's 50, you're going to ask them if they had a colonoscopy. You're not going to ask someone who's 25 if they had a colonoscopy, but you might ask someone who's 25 if they had a colonoscopy if they have a family history of, colon cancer. So you've gathered this information. Now you know what to do next. So if this is someone who's having anal sex, you should offer an anal pap smear. Otherwise, you wouldn't know. If this is someone who has multiple partners, you should have a conversation about PrEP to help protect them. So it really is important to ask these questions, because otherwise you won't know what screenings to offer. You won't know what preventative steps to offer. If they're on hormones, you're going to want to make sure that you're assessing them for clots, etc. So get comfortable. You don't have to be comfortable with how to give the hormone therapy. There's certainly specialists and clinics who do that, but you want to get comfortable with what the potential side effects of hormone therapy are, so that you have your antennas raised to know. And always, 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 this has nothing to do with the community, always screen for mental health. We do it at EG at every practice, at every visit. Even if you're coming in for an ear infection, we're going to ask you basic questions to screen for anxiety and depression, because it's an opportunity. The patient may not know that you're the person to ask. Some people don't know that you go to primary care for that question, or they may not be ready to, they may like, well, I'm here for an ear infection. Is it really the time to talk about my depression? Yes, it's really the time. And we're going to let you know that by asking you some questions. So I talked a lot about what happens in the practice. What happens once they leave the practice?
Well, especially if you're using referrals. So, in primary care, often care doesn't stop with you. So it would be great to have a great LGBTQ plus friendly referral list, so that if you're sending someone to a specialist, that they can go to that medical practice and their affirming practice as well.
And sometimes, depending on where you are, there is no gender affirming practice. So we live kind of metropolitan, kind of not, but I'm sure some listeners don't have access to gender affirming specialists. So sometimes I will tell my patient, hey, this is the only neurologist that I think would be really great for your particular issue. But I just want to let you know they're a little old school. They might not be gender affirming, but please don't let that stop you from getting this particular procedure done, because I really need you to have it. So even preparing them that they might not have the same experience that they have at EG or in your particular area is also helpful, because then you can say to them, listen, I'm aware you might be going to a place that's not affirming. I try to create gender affirming referrals when possible, but it doesn't exist for every specialty. But this is really important to get done, and I want you to get it done, so that they know that, because sometimes they'll come back and say, I couldn't go in there. So we want to have that conversation. Mm-hmm. I think so far, so good.
So far, so good.
I think we're awesome. Okay, so I think, what would you tell your PA students? We share NP students. She guest lectures in my classes often. Or new NPs, PAs, whether they're students or anyone who's just kind of ready to start and doesn't know where to start. What would you say to them?
I'd say this is a great start, first of all.
Yeah.
I mean, just even clicking on this and listening to this. And I think, exploring, there's a lot of resources out there, community resources on how to make your practice or you a provider that's, affirming to this community, and or learning from others who've already done it.
Yeah, so the first thing that you want to start with is just starting. So like you said, listening to this podcast is great, because it means you're interested. And we gave you a million things here. Choose one or two that you're comfortable with. You're already ahead of the game than when you were yesterday when you didn't do it. And it is, like I said earlier, I can't stress this enough, because I mess up all the time also. And people just assume that we're from the community, in the community, that we don't mess up. We mess up all the time. Just apologize, let the person know that you did not mean any disrespect, and move on. I promise you that they're just going to be so happy that you're trying to create a space for them. And I applaud all of you listeners for clicking on this, for listening to the end. You guys are awesome. NPs and PAs alike.
Great. Thank you.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Walters Kluwer.